Hi, I'm Professor Nick Makwana, and I'm a paediatrician who does both general paediatrics, acute paediatrics, so that's looking after sick children when they're becoming well on call, and also specialise in paediatric allergy. From an allergy point of view, I've got European accreditation for paediatric allergy, and I'm currently the chair of the paediatric committee for the British Society of Allergy and Clinical Immunology, responsible for developing standards of care and service standards nationally for children with allergy. And as we have to remember that children cannot necessarily speak for themselves, and therefore it's important for us to advocate for them, but also involve them in those standards as well. I'm also paediatric lead for the undergraduate curriculum for the University of Birmingham for the medicine degree, and responsible for teaching medical students about paediatrics. And I'm currently also the group director for women and child health at Sandwell and West Birmingham hospitals. That means I look after the services responsible for caring for women and children, including maternity services, neonatal services, school nursing and health visiting, as well as acute paediatrics. So I have a number of roles, but obviously my favourite part of it is looking after patients. So when I was younger, I really liked detective stories, and one of my favourite authors at the time was Agatha Christie. And I really like science, particularly biology. And for me, medicine encompasses both of those interests for me, because when you're talking to a patient, what you're trying to do is work out what's wrong with them. So it's a bit like a detective story. You get a load of information and then you need to work out who effectively done it. And I think the other part of medicine that I really enjoy is I really wanted to help people. And my primary school teacher still remembers at the age of 5, I said I was going to become a doctor. And I met up with her a few years ago, and she's very impressed I did actually deliver on what I said I'd do when I was 5. So during my training, I really enjoyed working with young people, and because I feel like I'm quite young at heart myself. And what I liked about paediatrics is quite a holistic specialty, meaning we need to understand the child in context of the family. And obviously patients and the parents are generally young people. What I also like is children are either unwell or well. So when they're unwell, they need help, but when they become better, they're quickly up and about and you can get them home as well. And I suppose making a child better really changes the life course for that child and that family, depending on what the underlying condition is. And what I really liked about allergy, it's a really fascinating area because there's massive developments being made at the moment. At one time, we could just diagnose and then we just had to monitor and treat allergy itself. Whereas now there's all this great immunotherapy where we can desensitize children and allow them to eat foods that they were previously wouldn't have been able to eat because they were allergic to them. And it's also, again, encompasses two of the things I enjoy. I really enjoy food and I really enjoy gardening. And obviously part of allergy is food allergy and aeroallergen and pollen allergy. So again, it's about combining what I really love doing both inside and outside of work. So the feedback I get from patients and parents is that I really listen to them and try and understand the root of the problem. I'm patient when I'm asking questions and give the time that they need. And I'm compassionate and understanding and really go the extra mile to give clear, easy to follow advice to them. I think working together with the patient, I use a process of shared decision making, and that makes sure that we agree a plan that we are all happy with, rather than just making a plan that I think the patient needs. And what I learned from patients is that I think they're able to teach me things as well, because ultimately I am a knowledgeable professional, but the person that knows the best really is the child or the young person and their family. So again, that's why there's that importance of shared decision making in working together to come to an outcome and a plan that both of us agree with. So the three adjectives I'd use to describe my profession is holistic, because really, as I've said, it's about looking at the child in context of the family. Challenging, because obviously a lot of these patients that I look after are babies or young children who might not be able to verbalize what's wrong with them, and therefore we have to try and work together to work out what's happening, and ultimately very rewarding, because as I've said, you know, you making a child better, you make a massive difference to both the patient and that family.